preparing meals for and assisting with feeding your client. There are many responsibilities that require thoughtful consideration toward your client. Preparing their meals and/or helping to feed them certainly fall into that category. Preparing a meal for and helping to feed your client requires careful attention to their dietary needs, preferences, and any medical conditions. Here's a guide on how to prepare and serve a meal for your client. First, assess your client's dietary needs by consulting the care plan or diet order. Review any physician-prescribed diets, such as diabetic, low sodium, or pureed diets. Make sure to understand any allergies, food intolerances, or restrictions. Now you have an opportunity to take into consideration what your client would like. For instance, if possible, offer options that align with their personal preferences, cultural practices, or even comfort foods. Next, evaluate the client's ability to eat. Check whether they can chew and swallow properly, or do they need modified textures, such as softened foods through cooking, or perhaps pureed foods or thickened liquids. Now, gather your supplies. Make sure that everything you need is ready, such as utensils, napkins, and appropriate dishes. Please be mindful that your client may need assistive devices. If they have limited mobility or dexterity, offer special tools such as adaptive utensils, plate guards, or adaptive cups. Of course, we need to consider hygiene and even personal protective equipment. Be sure to wash your hands before handling food, and if necessary, wear gloves and a face mask. Make sure that your client's hands are also clean before they eat, or assist with hand hygiene if needed. Now for the actual meal preparation. Of course, follow dietary modifications. For diabetic clients, use portion control and limit sugar and carbohydrate-heavy foods. For low-sodium diets, avoid adding salt. And use alternative seasonings if allowed. For clients on a pureed or soft diet, blend or mash the food to the required consistency. Balanced nutrition. Include a variety of foods from different food groups, making sure to include protein, carbohydrates, healthy fats, and that vitamins and minerals are covered based on the client's dietary needs. Check the temperature, making sure that the hot foods are hot and the cold foods are kept cold. And be careful when serving hot food that it's not overly hot for your client who might have difficulty sensing temperatures. While it's true that this is not meant to be a restaurant environment, you have an opportunity to contribute to your client's basic well-being by arranging the food attractively. A pleasant and appealing presentation can stimulate appetite, especially for clients with poor appetite or those recovering from illness. Portion control is important, so serve an appropriate portion size based on your client's condition, avoiding oversized portions. Even healthy foods, when served in excess, can feel overwhelming. If the client has difficulty cutting their own food, prepare it by cutting into smaller, bite-sized pieces. And if they have difficulty swallowing, serve liquids from fruits and vegetables that are thickened to prevent aspiration. And now on to serving the meal. Here are some things to keep in mind. First, make sure that your client is in an upright, seated position or Fowler's position if possible. This helps with digestion and reduces the risk of choking or aspiration. Provide the necessary tools. Your client may be fine using everyday utensils. However, if they require special utensils, such as weighted spoons or built-up handles, make them available and within easy reach. Ideally, your client will be able to feed themselves. This will contribute to their self-esteem, but some clients may need help lifting food or may need to be fed completely. Please be patient and offer them help without rushing them. This is a sensitive situation that may lead to some challenges. Please consider how these points may be helpful. It could be that in their frustration, your client refuses to eat. This can, of course, create challenges for you as well. So, what can you do? First, try to understand how difficult their situation must be. Losing our independence can lead to anxiety, depression, and the desire to withdraw. So by being patient and kind, you may be able to encourage them to open up. Gently inquire why the patient is not interested in eating. For instance, you could ask, "Is there something about the food that you don't like?" Or, "Are you feeling unwell or nauseous?" Listen and validate their feelings. By acknowledging their feelings without being dismissive, saying something like, "I understand eating can feel hard right now," you may be able to build their trust. Provide emotional support, empathy, and patience. Recognize that food refusal can be a form of control for patients who feel they've lost control in other areas of their lives. Offering gentle encouragement without force or pressure is important. Encourage small victories. Praise any effort they make towards eating, even if it's a small bite. Positive reinforcement can help. Also, provide reassurance. Sometimes patients may feel pressured to eat a large amount of food. Reassure them that even small portions or snacks are helpful. It may be as simple as offering a variety of choices and preferences. If the patient dislikes certain foods or textures, provide alternatives that they may find more appealing. Offer a range of foods to stimulate their appetite. And if possible, involve the patient in choosing what they want to eat, perhaps even discussing meal plans together. Create a pleasant atmosphere. It may seem like a small thing, but encourage eating in a well-lit, comfortable, and quiet space. Reduce distractions like TV noise if it makes them anxious. Sometimes patients eat better when sharing a meal with others. If possible, eat with them, or have friends or family members join during their meals. Again, we do realize that you are not there as waitstaff in a restaurant, but within reason, could you enhance the presentation? Make the food look visually appealing using colorful ingredients and arranging food nicely on the plate. Even small touches can help improve interest and appetite. And it may be that they just aren't that hungry. Try serving smaller portions multiple times a day rather than large meals. This approach can be less overwhelming. Offer nutrient-rich drinks. For patients who struggle with solid food, you can offer smoothies, soups, or nutritional supplements that are easy to drink. Hydration is key. Encourage water, herbal teas, or clear broths if they're unable to eat solid food. Hydration really is crucial for maintaining their health. Overall, it's about respect. Forcing a patient to eat can create a negative association with food and may worsen the situation. Instead, provide options and let them decide how much they are comfortable eating. Be patient. Progress may be slow, but continuing to offer support and encouragement can gradually lead to better outcomes. Be attentive. Monitor the patient during their meal. Observe signs of difficulty. Watch for choking, coughing, or difficulty swallowing. If the client shows any of these signs, provide assistance or notify medical personnel immediately if needed by dialing 911. Encourage your client to eat at a comfortable pace to aid digestion and reduce the risk of choking. After the meal, help your client relax. If the client needs help, gently clean their face and hands. Reposition them, making sure that they're comfortable. If they need to lay down, wait at least 30 minutes after eating to reduce the risk of acid reflux. Encourage them to express what they would like for upcoming meals, and make note if there are any dietary concerns. Observe for any signs of discomfort, nausea, or digestive issues. Pay attention to symptoms like bloating, abdominal pain, or difficulty breathing, which might suggest an adverse reaction or intolerance.